Hello everyone, my name is Mrs. Tonoba Yokuni. I'm a warrior and a health coach, the president and founder of World Healthcare Foundation. World Healthcare Foundation is a non-governmental, not-for-profit making and non-political organization established to help the health challenged people, most especially women and youth living with sickle cell disorder and other health-related issues. Welcome to our webinar today. There's a very, very beautiful topic that we want to look at today. Something that every one of us all over the world, I'm sure we are waiting for. And the topic is the permanent treatment of sickle cell anemia using gene therapy. And our guest speaker today is Dr. Ugbona Ugochukwu from the United Kingdom, a specialist in regenerative medicine. He is going to throw more light on what gene therapy is all about and is using in the permanent treatment of sickle cell anemia and beta thalassemia. Why not sit back and enjoy this life-changing presentation with us? Thank you and God bless. Bye.
Hello, sir.
Yes, Mr. Pius.
Yes, sir.
Thank you, Pius.
I said my question. Yes, sir. My question is there a possible way of preventing it through, let's say, a method like IVF? Let's say if the parents are already carriers, is there a means to prevent it from their offspring getting it?
From our own perspective,
Yes,
if parents are both carriers and one parent, this is a gene therapy. One parent, be the father or the mother, goes through the treatment. It corrects the genotype of that particular parent. That ensures that none of the offsprings will come onto this. If you remember my explanation, the science behind the chemistry behind this, I used the analogy of planting on a rock. If this treatment were just to remove the bone marrow and put in new ones, when the new ones finishes, they will start producing the same old stock. But this is not like that. This treatment now goes like gene editing. It will edit that mutated gene, that defective globin, and makes it normal. So the way people who are not carriers are, who are not traits, who don't have the traits are, that's what the patient will be. So if somebody is on a corrective treatment, hello, Pius, can you hear me?
I'm here. Yes, I can hear you, sir.
Yes. So our advice is for one of the couples to do the treatment.
Okay.
If the couple does that, the offspring definitely. The worst case scenario will be that one of their offspring could be a carrier, meaning AS, but none will be SS because one of the parents is normal, will become normal AA, whereas the other spouse is AS.
Can the person that do this transplant, can he marry an SS? Can the blood now change to A?
That's exactly what it is. Because the genotype would have been edited, meaning it has been corrected. Now the body will not be producing normal red blood cells, devoid of the sickled ones. So an SS person, they can be married. What we will always advise is for them to go for tests before and after treatment. Once they are sure, they see the test. This test is very self-explanatory. The test will tell you what your body is now producing. And at that point in time, because it's a gene-based treatment, the genotype will ordinarily now turn to AA. Why we are not using the word, I don't know at what point you joined this webinar, we don't use the word cure because by global standard, World Health Organization says you cannot claim cure until you have corrected other things that the body has been going through that has been damaged as a result of this. Somebody who has a vascular necrosis, an orthopedic condition, or the femoral head or joints, you have to go and correct that one. Whereas that is not the thrust of this treatment. Yes, we do treat that one under regenerative orthopedic treatment. Somebody who has a large spleen, you will also treat that one separately. So you cannot claim cure. But you and I know that the major thing, once you treat of this underlying case, any other treatment you do on any other secondary condition becomes sustainable. You tell me, with the body not being able to send enough oxygen and nutrients to different parts of the body, the development of those body parts will not be premium, will not be optimal. But once you treat and circulation continues at a very maximum rate, like I told you, with this treatment, after 4 days, when it comes to money, our people are very particular, and you don't blame them. We have had cases where people who are doubting Thomases, why has it not been announced? Why don't we know about it? Why is it not on the net? Pharmaceutical products globally, medical cases globally are not done that way. Because as we speak, yes, it's being engaged. As we speak, people are recovering. As we speak, there are continuous extended clinical trials, 6 years, 10 years after it has been dispensed. People don't know what goes on behind, because you need that length of time to see that these people are solid and well and healthy and moving on. Sometimes the clinical trial on this will continue after people have even been treated, gotten married, have their own children. It is at that point in time we are benchmarking. So you can imagine a 12-year-old today, a 6-year-old today. You want data to support that you treated this person, and this person at 6 went through school and now got married and have their own children and their genotype. You now check the genotype of their future children yet unborn. So that's why medical science, they are not like politicians. They don't go to the marketplace with megaphone and be announcing, vote for us. They do their things ethically. So the industry where we are is such that is a subdued one. And again, in this world of today, science is about superiority. We may not understand it, but in the Western world, there's a battle of who knows what, who knows much more, who controls this, who controls that, who wins the next Nobel laureate on physiology, which is medicine. We have never gotten that over in our own part of the world. So if our group of scientists come up with something like that, the ones that believe that they are the naturals to always win it, that they are the first to go to the moon, they are the first to go to space, will also come jumping. Who says so? What do you know? Where did you learn from? So those are the questions. So when scientists come up with this, they lay low, instead partner with those big ones. And the world is okay once they hear that is the one from Switzerland that found it, or the ones from France, or the ones from the US, or from the one from the UK. They say, oh yeah, those are homes of great science. But Nigeria or Africa, we don't know anything about them. Are you sure it's not voodoo science? They will call us all kind of names, but it's okay. We are not competing. We are partnering with them. We are one whole happy global family. The most important thing is that please remember us, because as we speak today, the budget, the percentage of what they mark out for their own research and development is justifiably high, and we don't care about that. So when they invest so much in looking for these things, even if they don't get it, they get bit of it, which is okay, sustaining us now. But it's about time. If we know that we are brilliant enough, that we are also part of humanity, it's not about what somebody tells us that we're not good enough. It's about let's prove ourselves right. And that's what we are doing. And by the grace of God, I think, like I said before, we are people of faith. Our God has sent relief to mankind through us in this area.
Sir,
yes,
and the lab that you say is in Lupeju, is that where we are going to do the test before we now do the normal treatment? Then we come back to that lab to come and confirm the test back.
Exactly. It's not only in Lupeju, it's all over the place. The name of the lab is called SYNLAB. SYNLAB. If you say Google, please, branches of SYNLAB in Nigeria, it will tell you 43 Adetukumba Demola Crescent, Victoria Island, Lagos. It will tell you Town Planning Way or Coca Road in Ilupeju, Lagos. It will tell you another place in Festac. It will give you the one in Lekki. It will give you the one in Port Harcourt, Abuja 1, Abuja 2, Ilori, Enugu, everywhere. Wherever they are, you just Google it, the address will be there. You go down there. You tell them that you are coming for HB electrophoresis test. Even if you get across to the organizers of World Health Foundation, they will give you the details, telephone number to call the laboratory,
Thank you, sir.
Thank you, madam.
Good morning, everyone.
Good morning, Ms. Victoria.
Okay, my question. Good morning. I'm a special need consultant, and I also do assessment and diagnosis. So I have situations where I have sickle cell anemia students, and they display some behaviors that are quite abnormal, like, talking to themselves, repeating words. For an educationist, my concern is what could be the cause of all this strange behavior. So,
Good.
yeah, I think that's my question.
Now, thank you. You're in the heart of it all.
Thank you.
In the midst of children at their formative ages. One thing about this condition, there are some people whose symptoms manifest early in life, after 6 months of age. There are some other ones that are not symptomatic until mid-adult life. Some of them mid-teenagers. They never knew they were carriers, talk of being SS, until they have finished secondary school or in the uni. Some people, they get married when they're pregnant. One of the antenatal checks, now some symptoms will manifest. So you can tell, because this thing is congenital, whatever the impact it has on the individual starts from the womb. In medical practice, there's what we call particulars. We separate the body into segments. When a patient comes and you are clacking that patient, first, mental particulars, meaning the mental symptoms on the mental sphere, how that person reasons, that person's behavior. At the end of the day, when you finish with asking questions, do you have visions? Do you see dreams? Do you hallucinate? Do you do this? Do you do that? And you are recording. That aside, before you go, what part of the body pains you? How do you sleep? What part of the body do you sleep on? Do you lie on the left side or right side? Do you have pains on your chest, on your head, on the abdomen? Those ones now you're talking about the physicals. So you start from the mental, then the head, the neck, the chest, and the lower extremities. One thing you will notice is that most of the time, You don't control how you reason and how you behave when you are not well. As an adult, as a teacher, you will agree with me that what we consider to be ordinary malaria, symptoms of malaria, onset of malaria, and when you are fully into malaria, when it has engulfed your whole organism, you may be thinking, let me use the normal Nigerian jargon, you may be thinking that village people have come again, just for malaria.
Yes, sir.
And other things. Even pregnancy for women, hormonal activities on the women. Women will do things that they themselves cannot believe that they will do under the pangs of pregnancy. And that is mental as well, and physical now, or physiological. So what about children who ordinarily, you will say, tell somebody, stop behaving like a child. You are not a child, grow up. Now that child, on top of you asking the child to grow up, is also overwhelmed, is engulfed by a condition that has been inside of him from the mother's womb till now. So that is what you would call a double whammy, or we call it complex miasm, meaning when more than one condition is engulfing an organism, a human being. So when these children come up with all of those, you as an early child specialist, you will now profile their psychology to understand that there is something underlying that is making that child. You can imagine our great-grandmothers and our ancestors not being able to articulate these things this much. The easiest way for them to throw away this case and get it done with is to categorize that child as Abiku or Banje or Mami Water or one thing or the other. And they will match that child either to a priest for deliverance. It has nothing to do with that. Remove this miasm. Sorry, this is not a medical conference, but I have to speak in that way to be able to explain. Remove that miasm from that child today, and the next day, you see a different behavior. A warrior who is a young person has been living in an ostracized world from the time he was a child, cannot swim with other children, because once he swims, he will have come down on vaso-occlusive crisis. And going through that for a child, others are going to play, the mother will call him back. It's raining, they want to go and play rainbow. The mother will pull him back or her back because the mother is trying to protect that child. After 6, 7, 8, 10 years, that child feels that I am not like Junior. I'm not like Emeka. I'm not like Bimbo. Why am I just always being cautioned? My siblings are going out there. Psychologically, it's beginning to form a pattern, a mental pattern on that child. So that child sometimes, there's what they call soliloquizing. That child will start talking to himself or herself on their own.
Yeah.
So that is, those are the trainings that special need teachers. Good enough. Kudos to you. Congratulations. You must be a good one at that for you to understand this. Because not all teachers, some teachers will just pull the parents out and say, Madam, carry this child, go look for another school. Maybe this your child, you get mental problem. I'm sorry to say it that way. I'm trying to communicate, So not every teacher will take time, attend webinars like this, and pay particular attention because of other people's children under her care.
Yeah.
So I definitely commend you and your interest in getting it right and doing it better. So
thank you, sir.
Always, yes, sometimes you recommend for the school, if they have a medical team, or the parents, without misunderstanding you, that you know that this child is normal, but from your experience, that you know that there are some other underlying health conditions that can make this child be behaving like this on the mental sphere. It's not madness, it's only mental symptoms.
Okay. Thank you, sir. That makes a lot of sense to me. Thank you.
Thank you.
I want to ask that once the treatment elapses, how long does it take for it to elapse? And what do you do when it elapses?
The treatment is for 15 days. And that, by the 5th day, you're already out of the water. Hello, Taju, can you hear me?
Yes, I can hear
Hello,
you.
Taju. Okay. The treatment.
I can hear you.
Yes, the duration of the treatment is for 15 days. But the treatment is very effective. Come the 4th and the 5th day, you're already feeling very well. Yet you continue for 15 days and finish the treatment. After finishing the treatment for 15 days, believe it or not, your body will be doing things it never did before. We've seen some mothers and some teenagers. Once they start their treatment, they have bouts of energy to be able to pull generator and turn on generator for their mothers. They'll be able to do a lot of things. The ones that have leg ulceration, if we then treat for that leg ulceration, it heals, it goes. You may have seen people that come down with leg ulceration because of poor circulation to the lower extremities of their body, their legs. Because of that, there are some necrosis of those leg skin tissues, and they develop sores there. Even if you treat for those sores, they may go temporarily and come back. So the advantage of this treatment is such that the moment you treat, the body is now firm enough to withstand and stop those leg ulceration. Is that okay?
Okay, sir. Thank you, sir.
Okay, good morning.
Morning.
Good morning.
Good morning.
Yes, sir. So I think I came late for the webinar. But I want to ask the risks concerning this therapy. What are the risks attached to it?
Oh, okay. Well, I asked if you join us from the beginning. The innovation in this gene therapy is that it is 0% chemicals. It's not made with synthetic chemicals like you have other drugs. It is composed out of phytostem cells. In the science of stem cell, you have two types of stem cells. You have what we call embryonic stem cell, which is stem cell harvested from embryos or placenta or from animal base. That's embryonic stem cell. With respect to hemostem, why you can take it orally is that it is stem cells that we are harvested from phyto origin, meaning plant origin. Today's science, you can use basically anything. Before 10 years ago, we believed then our knowledge never took us beyond embryonic stem cell. We saw phytostem cells as being unstable. But today, we now make medicines called biologics. Biologics, the same way you will carry vaccines. You make it without chemicals, without preservatives. I brought out a sample, a specimen. Look at what that medicine looks like. This is the hemostem. It is made out of phytostem cells of various categories, various molecules of different things, doing different things. Some of them are vector mechanisms that take it directly from the mouth into the bloodstream, at quick absorption. From there into the femoral head, the head of the long bone at the hip, into the bone marrow. Some of it into the liver, some of it into the spleen, Those are the kitchen points in the house of the body where blood formation takes place. Even inside the bone marrow at the cell level, it now penetrates and gets into the gene to correct that. It is a one of its kind in mankind. The same application is being used in developing treatments for HIV. Because HIV, you cannot sincerely use chemicals to formulate the therapies to kill the virus. If you do, it will affect other surrounding cells and tissues. So most of this stem cell gene therapy acts on a platform that elucidates certain antibodies in the body or enzymes. Some antibodies we call cytokines. Those cytokines, some of them are for anti-inflammations, some of them are for corrective things. The same platform that will kill those viruses is not directly killing them. It's making the body produce the cells, killer cells that will now kill and attack those viruses. So is this one. It is made out of phytocells that the body will not reject, that will not fight the body, that gets with the right vector, that gets to where the organ site is, and make the body itself. The body is a laboratory, has all the potentials in correcting every anomaly, but you have to gear it towards that specifically. That was why I explained what stem cells are, precursor cells, the basal cells, that you will now make it, or nature will use certain enzymes, repair and incision enzymes, to go and turn it on or off to produce the desired results. You and I are moving on as human beings. Every single second of the day, new blood cells are formed in our bodies. And so many other millions of cells of other areas are formed as a result of activities of nature. However, it doesn't always go well. If you're driving from Lagos to Ibadan, from Abuja to Kaduna, from Aba to Port Harcourt, sometimes you see some cars run off the road and run into the bush. That's how the human body, we are designed to obsolescence, meaning that nature designed us to expire, meaning that we have to be repairing and cutting off those ones. Nature has also designed those inbuilt mechanisms that cut off the unneeded ones and allow the other new ones come up. So from all you have known about sickle cell anemia, thalassemia, those cells that are sickled do not live highest 8 to 12, 14 days. They die and block the small blood vessels. Who is at work? The spleen now recovers them and discharges them out of the body system. Sometimes after we've gone through crisis of poor circulation. So this treatment is 100%, I repeat, phyto stem cells, zeroing in the safety. You do not have side effects by way of unwanted chemical in the body. That is why it has taken this long coming. And today, we beat our chest to say that it is here. And the ones that have benefited from it so far have been the ones sending words around the world. So be rest assured that this is safe.
Thank you very much, sir. Thank you very much.
Thank you. Okay.
Thank you so much. Can we have Mrs. Tolawale Kadijat?
Good afternoon, sir.
Good afternoon, madam.
Good afternoon. Yes, sir. My question is, this treatment, what is the assurance after payment? Are we paying before the treatment? The money is huge. Or are we signing an agreement before the treatment that after paying, this thing is going to work 100%? Or maybe after using the medicine to some extent, now make payment, or maybe you are paying half payment, or so. Because and another question is this treatment,
Yes,
the
please.
is it that after they use the medicine, they won't have any crisis again, there won't be any complaint or whatsoever?
Okay.
So those are my
Let me,
questions.
yes. Where are you calling from?
I'm calling from Lagos, Nigeria.
Okay. I lived in Lagos. There's a place, I don't know if you know Obalende.
Yes.
Okay. When we were young, we lived on McGregor Road in Ikoyi. In the evenings, we used to go through Federal Secretariat, the back of Dodam Barracks to Obalende, to buy fried yam and akara. And we would tell Mama Iyamodino to give us testing. So we would test the akara or yam first before we now buy the akara and eat. In medical science, it's different from marketing of foodstuff. Testing or jara is not part of the philosophy. What they do, you have the drug maker, different. He makes the drug, brings it to the attention of the doctors, the clinicians in hospitals or clinics. The hospitals and clinics will now, when their patients come, they tell their patients, they're not even allowed to advertise. You don't see Eco Hospital or First Consultant Hospital or Reddington Hospital advertising with sickle cell, come over, bring everybody. They don't do that in medicals. So the doctors, when their patients come, they can go on doctors' conferences and share this information among them. Then when patients come, they will tell the patients the condition. Some patients will say, okay, we'll pay in this money. Doctor, you're already our family physician. Please, we need our son or our daughter to be treated immediately before he goes back to school. But I don't have enough money now. Abroad here, there's what they call medical insurance. Your medical insurance will cover and pay while the patient takes the treatment. Whereas in Nigeria, I know how our system works. We are on our own. So the doctor will now say, okay, let me look at this family. All the 4 children were delivered in this hospital. I know Mr. Coker. I know Mrs. Mrs. Kadijat and her family. Can we discuss? My brother, my sister, this treatment costs like this. We have just signed on with the pharmaceutical company. They'll be supplying us. And we have till this day to pay them back. So what you will do, if you can write me a payment plan, how much you deposit now, and over what period you pay the balance, I can now, before our next turnover, we will use part of the ones we've recovered from other patients to deposit with the pharmaceutical company, coupled with the one you're depositing now. Please ensure that every month end, for the next 2 or 3 months, you will meet up. That means that that hospital or that doctor is creating credit for you. But the pharmaceutical company has a different arrangement. Now, what we are doing, some people upon hearing this are calling their relatives here in UK. Please contact these people, collect this medicine. They will pay, they will come and collect from here and take it to Nigeria. Sometimes some people will say, I don't have anybody in UK. How do I get it? We said, okay, let us ask around. This is summertime. We have people that are traveling and coming and going. Between now and the next 1 month, we will see somebody. Some people will say, if you can have somebody, I'll pay for the flight tickets. Please give it to somebody, let the person come, I'll pay for the tickets. So people will come up with different arrangements. whatever your own individual arrangement can be, please get across to the organizers of this webinar, World Health Foundation. I'm sure their telephone number is there. But if you want their telephone number, you can speak with Mr. Ayo. He will give you the telephone number. That one you can come and offer, and they'll process whatever the payment plan is. Sometimes people also have the money, but they are afraid that I hope this is not a scam. When it gets to that point, we have ways. We can have a lawyer. You will go and pay the lawyer together with Mr. Ayo, the organizers of this event. The lawyer holds it and signs and gives you a paper, a receipt that you have paid for this, for so and so, and look at the benchmark and thresholds of what you are looking for. In the event this thing happens, I want my money paid back. We will create that. Mr. Ayo will advise you on how to go about that. And in that way, what we are trying to do is to build confidence. If, for instance, something like Panadol, paracetamol, there's all these anti-malaria you have, they're medicines. They may be selective, meaning that you have malaria, you take it, your malaria is still there. It didn't work, but you're not going to these manufacturers to ask for their money. But this gene therapy is one of its own kind because it is not selective. It works for everybody. And we are beating our chest and telling everyone who cares to listen that by the time the 15-day treatment has gotten to the 5th day, the threshold of new red blood cells in your body would have changed so much, built up so much, that you will not have crisis. There are some parents that have been holding back, trying to raise money for the treatment. Suddenly, their child gets into crisis. What do they do next? They say, oh, doctor, please, where do I take this child to? This thing has come. While that child is still going through crisis, the treatment is sent to the child, and they start administering. The child, not only will he or she get out of that crisis at that point, yes, he will, and get better. Never. The ones that cannot swim has tolerance for cold water. The ones that cannot stay in air-conditioned rooms now turn on the air conditioner. Parents will be looking at them, or they themselves, or spouses. What are you doing? They say, I'm hot. When did you start becoming hot? Are you not the one that will not stay on that fan or air conditioner? Well, things have changed. Blood matters. Hematology is such that if you use the tip of a needle or pin now, drop it into arsenic trioxide, which is poisonous, and put on somebody's tongue, just that little tip of the pin, in the next less than 5 minutes, is blocking the pathways, and the person will start foaming. Less than 5 minutes. The same thing, if you bring arsenicum album, a potentized remedy made out of that arsenic trioxide that counters it, and drops it on the same person's tongue, less than 5 minutes, the person will be normal. So that's how things that work on blood plane, how fast they act. And this is one of those. I have seen it repeatedly. We have even used it. An HIV/AIDS patient that came in on late presentation. The viral load is so high, the CD for immune cells, we are uncountable. They cannot detect the CD for immune cells. Was very emaciated, oral thrush, cannot eat. When we saw this person, we did not look at the underlying factor. While treating for that one, the first thing we did was to bring this hemostim, but not as much as for sickle cell. Gave this patient hemostim for 2-3 days. Believe it or not, usually before you start treating an HIV patient, you draw blood and test for viral load, counting the number of viral particles. In that way, you know how long and how deep the treatment will be. This particular patient, we put in needle, Not a single drop of blood came out of this patient. This patient was almost gone. A manager in one of the NNPC subsidiaries from Abuja to bring him to the clinic in Enugu. National Hospital in Abuja discharged him to go home and come back in 3 weeks. We know what that meant. He knew they wanted to clear the bed. His PA and driver now put him in the car. His brother in UK called me when we were in Enugu, brought him to Enugu. Between Abuja and Enugu, somewhere in Kogi, he came out to urinate and collapsed. They packed him up in there. With this thing, in 3 days, blood has built up in him so much. While we are treating for the virus, we're also treating to build him back in vitality. We called this same lab, their office, their laboratory in GRO behind the Parkland Teaching Hospital. They came when we couldn't find any vein. They came, tried and tried. They have the records of these things. And they couldn't find any vein. 1 week later, when we have seen his vital signs on the improved level, we called them back. They came. Blood splashed out of him. Just within 1 week of taking this. Not taking it as much as a warrior would take. Not taking it 3 packs, 3 times daily. A pack 3 times daily. Just the one we figure will be able to build up his blood. That is how efficacious this thing is. So I am telling you, the science and the knowledge behind this is unparalleled. We are privileged as our own people to be informed about it today. But going forward, you will hear the global review on this, in very many medical fora. I don't know if I've been able to answer you, Ms. Khadija.
Yes, sir.
Okay, let's have Professor Witty.
All right. Good afternoon from here. Good afternoon, everyone.
Good afternoon.
Good afternoon.
Good afternoon,
Yeah.
sir.
Yes.
Good afternoon, Prof.
I wasn't. Yeah. After you asked me to unmute my mic, but I wasn't allowed to speak. So it's just now that I've been allowed to speak. I want to say thank you for this enlightening session. I am a health coach, and what I do basically is to create health awareness programs across various sectors, educate people, inform people, get them aware on health matters. And one of the major challenges I've met is to come across sickle cell patients, sickle cell warriors. And there's still a lot of misinformation and ignorance about it. So when I got to know about this, I was very glad. I'm very glad to be a part of it. And I've been listening and following keenly from the beginning. Because of what I do, which is basically to the grassroots, I have lots of them. I'm based in Abeokuta, Ogun State. So I have so many of them, the uneducated ones, the semi-literates. Most of them are not even in the elite category. And I would really want to bring some sort of succor or solution to the people at the grassroots, for their own sake and for the sake of research, because I believe that this would increase the sample size in terms of feedback. You want to study and get to know the response of their response to this form of treatment. So I would want to talk about the pricing. Yes, I know that it's a standard price, and that's how it is. We don't negotiate, just as you said. But I wouldn't know if an arrangement can be made, especially for those who live in rural areas. You can't even afford the cost of transportation from Ogun State to Lagos State with the way things are right now. So cost of transportation is even a put off, not talk about the cost of treatment. I wouldn't know, sir, if an arrangement can be made to consider lots of these indigent individuals who cannot afford this. I was at FMC some weeks ago, especially at the children emergency ward. About 80% of the children in emergency ward are sickle cell patients. So it's a big bother and concern for me as someone who relates directly with them, who has lots of them as friends because I talk to them a lot. If any consideration or arrangement can be made that they also can consider and feel that, okay, they have a hope on getting a solution. Thank you.
Thank you, Prof. In fact, I very much appreciate your input. By the way, good job you are doing. I want you to write down this drug. It's called Zolgensma. 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 Zolgensma is a gene therapy that was approved about 4 years ago for the treatment of spinal muscular atrophy. Babies born with spinal muscular atrophy, their intestines and muscles do not develop. So eating, the intestines cannot handle food. Their breathing, their trachea everywhere is challenged. So most of the time they don't live past the age of 3 years. The cost of Zolgensma, if you Google it now, just Google cost of Zolgensma, you will see $2.11 million. $2.11 million. What is an American laboratory out of Illinois, Chicago, that developed that drug? And what they did, Novartis, the big global Swiss pharmaceutical company, acquired them. And they know that not every person has $2.11 million. $2.11 million is the medical cost. That is what the doctor pays the pharmaceutical company. The hospital cost, meaning the doctor's administrative cost, what the nurses, all the lab tests and everything, and administering the drug comes on top. 5 years ago, it was the most expensive drug. Today, there are some other ones called Limeldi, also for hematology. Those ones, some of them, $3-something million. They know that not everybody can afford it. They want everybody because it's meant for human beings to elongate the lives of people, be you rich or poor. What they did, they went and taxed their respective health systems. Medical insurance is abroad. They allow hospitals to take them, administer, and those hospitals will be paying $500,000 every year, spread it over 5 years. Over in Nigeria, even abroad, not everybody has $500,000. In the UK, they took the government, whosoever wants to be the governing party, be you the Labour or Conservative, the most important thing you have to assure the people is the NHS, the medical system. NHS England and Scotland and Wales took it upon themselves, looked through, and people don't pay for the medicals in UK, but they still have private clinics that do things more than the NHS can do. So they negotiated with Novartis. NHS now stocks it. What NHS did was to go to Novartis and say, listen, we are not hospitals, we are group, the whole country. So we have so and so number of children, up to 300 every year, or more than 300 every year are born with this condition. So we want to negotiate bulk with you. Instead of that 2.11 million, can we negotiate at 1.9 million? Because it's their concern, every life, every individual matters to them. They take every single life very important. They even take animals. But we are not blaming ourselves. We are not yet there. By the grace of God, Nigeria will get there someday. What we usually do is that the pharmaceutical companies, they make drugs. Hospitals, they administer these drugs. But they create, you come in a society where a lot of people are blessed. It doesn't mean that the ones that don't have money are not blessed. But some people are more privileged. So what this organization now, World Health Foundation, is doing, what you are doing, they will come together and now do fundraising, call the well-meaning people in the society, call the pharmaceutical company or the clinic like us in and say, we are doing this in our community. Please support us. If we can generate enough money to help the underprivileged, at least support, we have done our own bit. Everything is not profit for the company. Give back some to society. There is nobody you talk to in that way. No organization you talk to in that way. We have this. You say what you saw at the hospital in Abeokuta. It is mind-blowing. I have been on the front line at the clinic level in Nigeria. I have seen, even before I became a doctor, as a younger person, I used to go to the hospital, and I have friends who will be on crisis, who will not even know it's crisis. They say he's not well again. We say, oh, we miss him because he's our playmate. We will go to the hospital and say, I'll be saying, sorry, sorry, sorry. The next minute, he's out of the place with us because he's in pain and will be around. After a while, some of us will be crying. So we know what families that have warriors. That's why they are called warriors. It's not of their own. It's not in their making, but it's just one of those things that faith can only carry somebody through. So I've heard what you said. When empathies go first, there will always be way. They say where there is will, there will be a way. We are ready to, because it is endemic in our own country, in our own communities, at every level. The Fulanis, the Hausas, the Igbos, the Yorubas, the Biron, every Ijaw person, there is no tribe in Nigeria that is exempted from this. We are all involved, and we will all contribute one way or the other. Keep in touch with the organizers of this forum, the World Health Foundation, and we will always find solution one way or the other. Hello, Prof.
All right, thank you very much. Much appreciated. Yeah, that's much appreciated. Thank you very much.
Okay. Thank you.
Hello, Doctor.
Yes, please.
Olajide again, Sickle Cell News.
Okay.
Yeah, concerning this therapy,
yes,
do you
please.
have, like how many people has it treated successfully? Is there a success rate? Is there a failure rate? You did mention that it's 100% guaranteed. Is that really so?
It is really so. It is really so.
Okay.
We are. You will liaise with Mr. Ayo of World Health Foundation.
Certainly.
Come next month. We will have a particular case of a patient who has volunteered and agreed for the benefit of other Nigerians.
Okay.
That while undergoing her treatment, she will be live online 3 times a day while taking her medication for the 15 days. she has also obliged that her HB electrophoresis tests will be made open and available.
Very good.
For people to see her status before treatment and see her status after. Usually, we encourage for tests before and 6 months after. In her own case, we have arranged with her to give us a consent so that she will run the tests. After the 15th day, by the 17th day, she will run another test and show how far her blood work is going. And every month after then, she'll be doing monthly blood work to see the progression, how fast these changes take place until the 6th month. That is the final one, post-treatment. And that will be in the public domain. It's information that will give comfort to a lot of individuals and families and even support network. There are some donors that may want to remain anonymous, but they are not sure. But upon seeing this and verifying it through a standard laboratory like SynLab, they will be able to say, oh, okay, so if I sponsor 2 or 3 patients or warriors who are indigent, I would have done something with myself. And I'm sure that money is money well spent. If I can see this girl, the patient we are talking about is out of a lorry in Kwara State. And the person also has obliged but would not want to be seen for now until then.
Like how old is she, sir?
Huh?
Like how old is the lady?
The lady is in her 20s, in her mid-20s.
Okay. Okay.
You know, so that's how it is. What you asked about number of people, we have treated a lot of people in the past 4 or 5 years. One thing you will hear is that we have had calls from people who saw people they knew before, who were warriors, suddenly seeing them robust in great health, doing things they couldn't do before. Went to ask them, and those ones will whisper and eventually give numbers. Some others will go to church and give testimonies, and people will hear that from the testimony in churches. We have had somebody call us to say that the person was in a bus from Enugu to Port Harcourt, and one woman was talking about it in a bus. And that woman managed to they got a contact, traced the person that was treated, and finally got our number from that person and called. You know, so the people call from Holland, the Netherlands. We have more people calling in from the US and Canada for this same thing than even people in the UK here. Because the UK system has its own great pluses. It caters for everybody regardless of the cost. So most people in the UK, they have their money to be able to do other things and keep their lives going, but not to pay high cost out of pockets medical bills. But the ones that have the means, they do pay. You know, so quite some people in the UK, they are waiting for when NHS, the National Health Services of UK, will now start underwriting this cost for them. You know, so, and our people, nobody goes out there shouting, oh, I've been healed. You know, when you ask them, they say, oh, it's gone, or your health is getting better. You say, yes. You know, few people will now tell their friends and their colleagues, you know, what happened.
Okay, thank you, sir.
Thank you.
Everyone. Sir. Okay. Thank you so much. In the presence of no question, I think we are rounding up now.
All right.
God bless you. If you have any further questions, you can drop it for us on our platforms. We can always get back to you with answers. And we hope that you take this good news to our people all out there, that the solution has come. God has finally brought solution to us. Thank you so much. God bless everyone. And we hope that you will also be in our next webinar. Thank you. God bless you. Doctor, we appreciate you, sir.
Thank you.
Yes, sir. Thanks.
All right.
Okay,
Bye-bye, everybody.